We are starting, I'm going to start a GynecoMASTERcast. GynecoMASTERclass. Ron Schuster here today. I'm going to start a GynecoMASTERclass. I have a special interest in treating guys with gynecomastia and have been doing that for 20, 30 years. I have a lot of different content out there, but I thought I'd go back and do a little intro. Gynecomastia is, by definition, breast enlargement in a guy. It can be caused by either fat, glandular enlargement, the breast gland itself enlarges, or a combination of both. Generally can occur for several different reasons. The most common are just physiologic changes that a male goes through in life. So even starting as a newborn, neonatal gynecomastia is very, very common. And this is being caused by, as the estrogen crosses the placenta and reaches the fetus, it reaches the baby before they're born, and then they're born and they have a little bit of a nubbin, a little bit of breast enlargement, a bud. Typically goes away within a couple weeks. The next time would be during puberty, when there are a lot of hormonal changes that go on. And that is by and large the largest time when males, guys, will develop their gynecomastia. It can go away on its own. My anecdotal experience is if it doesn't go away within a year, it's probably not going to. And because of these hormonal changes, what happens is increased levels or increased ratio of estrogen occurs, sometimes maybe because of the increase of testosterone. I don't think there's ever been really good studies to show exactly what's going on as far as these levels, but it's the estrogen component, whether it's just a relative increase because of the breakdown of testosterone, that is causing the breast gland to enlarge. And then the next phase, physiologic changes. As guys get older, generally we accumulate more fat. And if there is any breast tissue there, the gland typically gets replaced by fat. So as we get older, some studies say that it could be 50 to 70% of guys over the age of 50 have some degree of gynecomastia. So you're talking about a very prevalent condition. It doesn't mean it's cancer, it doesn't mean it has to be removed, but it causes a lot of psychological distress in a lot of guys, especially in their late teens, early 20s, 30s, especially if they have glandular gynecomastia. The thing you need to understand is that glandular gynecomastia is different than sort of fatty gynecomastia. Fatty gynecomastia is often referred to as pseudo-gynecomastia. I really don't make much difference in the two conditions. I mean, there is a difference of treating it, but the effect on the person is pretty much the same. It's more of a psychological effect than anything else. The take-home message I want to leave with you today is gynecomastia is very, very common. You should not be embarrassed by it. Sometimes it will go away. There are some things that can improve it, but by and large, if you have true glandular gynecomastia, it will typically not go away without surgery, okay? And so I'm here to help, and that's our first class today.